Thanks. Good afternoon, everyone. Thanks for joining us today. Since the last media advisory, we have one new confirmed case of COVID-19 in our province. This is an individual under the age of 20 in the Eastern Health region and is contact of case. There have been 32 new recoveries, 25 in Eastern Health, 7 in Central Health, and leaving us with 60 active cases in the province. And the total number of cases for our province is now at 1,995. One person is in hospital as a result of COVID-19. As you are aware, there is currently an IT outage affecting the provincial healthcare system. Several technologies that are a part of the COVID-19 response have been impacted by this outage, and I'll take a minute now to go through these. First, the online self-assessment and testing referral tool is not available. So if you need to book a COVID-19 test, please call 811. This applies to anyone who is a contact of a known case of COVID-19, travelers arriving to Newfoundland and Labrador that are not fully vaccinated, anyone who has received a notification from the COVID-19 Alert app, anyone needing a test as a result of an advisory from public health, and of course, anyone experiencing one or more symptoms of COVID-19. Since the portal to check COVID-19 test results is not available. So if your test result is positive, you will be called by public health within 72 hours. If you have not been contacted after 72 hours, you can assume your test is negative. While we don't usually say in medicine that no news is good news, for right now, we are saying that. The public health laboratory is able to continue processing COVID-19 test swabs, and a process has been established to notify the regional health authorities and the Department of Health and Community Services when there is a positive result. Thankfully, there are no impacts to our vaccination programs for COVID-19 and seasonal influenza. So anyone can still book a vaccination online or go to a walk-in clinic, a pharmacy, or physician in their area. Most vaccines are recorded using the electronic medical record system and the pharmacy network, and these have not been impacted by the outage. What has been impacted is the ability of the Newfoundland and Labrador Centre for Health Information to collect data from those systems and update our online data hub. So there will therefore be a delay in updating data regarding our vaccination rates. Finally, our online form for travelers is not available. So travelers with an existing reference number can provide that number to border officials at their point of entry into the province. And travelers without a reference number can complete a paper form when they reach their point of entry. I really would like to thank everybody in our department, in the regional health authorities, at the Newfoundland and Labrador Centre for Health Information, and many other organizations that are working diligently to address this issue. It is incredibly disheartening to see our healthcare system hit with another major curveball while we are still in the midst of a COVID pandemic, but these teams are phenomenal and they really are going above and beyond to get us back on track. So I really am grateful for them. One way that everyone can help this situation is to get the flu shot. And if they haven't done so already, their COVID-19 shot. We need to do all we can to keep these serious respiratory illnesses at bay and to avoid overwhelming our healthcare system during this very difficult time. Those as young as 6 months old are eligible for the flu vaccine, and those aged 12 and older are eligible for the COVID-19 vaccine. So if you've not yet had your first or second dose of COVID-19 vaccine, you can get your flu shot and COVID vaccination at the same time. As I indicated on Friday past, we are very hopeful that we will soon have Health Canada's approval to begin administering Pfizer's COVID-19 vaccine to children aged 5 to 11. This is important to protect children's health, to reduce the overall risk of school closures, to help strengthen our overall provincial barrier against COVID-19. Once we have the green light, we will move quickly to begin that immunization program. The National Advisory Committee on Immunization also issued new recommendations for booster doses in select populations last week. And a booster dose of an authorized mRNA vaccine should be offered to these individuals, but at least 6 months after completion of what we call a primary series, which is for most of us 6 months after your second dose of vaccine. Regional health authorities are currently administering booster doses in long-term care homes and other congregate living settings for seniors. And the RHAs are currently working on plans for delivery of other booster doses in accordance with NACI's guidance. And we will announce those plans in the next few days. For anyone just joining us, we have one new case of COVID-19 in our province. This is a very difficult time for both healthcare providers and patients. And now more than ever, we need to show patience and kindness to one another. So hold fast, Newfoundland and Labrador. Thank you. Back to you, Leslie.
Thank you, Dr. Fitzgerald. We have 4 media registered for today's availability. The first round of the question and answer session will give each reporter the opportunity to ask 1 question and 1 follow-up. Following this, there will be a final round where each reporter will have the opportunity to ask 1 final question. Our first questions are from Garrett Barry with CDC. Please go ahead.
Thanks. I believe, or I understand, that as of this time last week, public health was doing about 900 COVID tests a day. Do we have any sense of how many tests are being done daily now, and how much that number has slowed because of the outage?
Yeah, I don't have that information. That is unfortunately something that is an aggregate number that we're not able to get right now out of the system. But yeah, you're right. I mean, there is a decrease just simply because of the booking system being down, but that's being worked on at all the regional health authorities now to make sure that we get those people who had gone into the system get their tests booked and going forward.
Do we have any sense then of how many people are waiting for testing appointments because they've called and haven't gotten them yet?
My understanding is it's less than 200 at the moment, but you know, that's approximate.
Thank you.
Our next questions are from Richard Duggan with VOCM. Please go ahead.
Thank you. Dr. Fitzgerald, would you say that the Marystown cluster is contained now?
Certainly public health has a pretty good handle on what's happening there. There are some people being tested as it is, you know, we have testing towards the end of a quarantine, so we may see some more cases from that, but thankfully we haven't seen a spread out into the community beyond those close contacts. So that's very reassuring, and I think a big plug for how well vaccines work. This group of children especially had a well-vaccinated group of adults around them, and I think that went a long way to help prevent the spread.
And I want to ask about you mentioned in your preamble about the hopefully soon getting the approval for the vaccine for kids in the 5 to 11 age group. For kids who are, say, 11 years old, but physically they're as big as someone that's, say, 14, 15 years old, will they have the same level of protection if they have to get the smaller dose of the vaccine for the 5 to 11 group?
Yeah, so when it comes to your immune system, you know, the dosage is really about, it's not so much based on your weight, like it would be for certain medications, for example. So it has to do with the immune system response. And we know that children have a very brisk, I should say, immune system response to any kind of antigen, which, you know, would be a virus or bacteria or a vaccine in this situation. So, you know, the immune response should still be triggered and be just as robust.
Our next questions are from Peter Jackson with The Telegram. Please go ahead.
Hi, the mute button's in a different place. Why did Canada's chief medical officers feel the need to release a statement about booster shots for the general public? Were you in on that particular statement?
Yeah, so we all were. I think for the most part, we just wanted to show our support for NACI and to show our support for the direction that NACI was taking with regard to booster vaccinations and really focusing on those groups that need them most and where the evidence supported that. So that was the main reason. And, you know, we've given statements before whenever there's been where we felt that we, you know, needed to come out and say that we support the decisions that are being made. And I think, you know, this is another big part of a vaccination program talking about booster doses. So I think it's quite reasonable as Chief Medical Officer's Health for us to come out and say that we support the direction being given.
Okay, thank you. I'm not sure if you can answer this, but I'm still hearing of complete confusion over the procedure to apply for legitimate exemptions from vaccines. There's confusion on the part of doctors, on the part of people who are scanning vax passes. No one seems to know how this works. Is that process going to be spelled out a little more clearly on the website?
So there are, there are in the electronic medical record, there are ways that can happen, and there are forms that can be completed, and messaging was sent out to inform both to practitioners and to inform how to go about getting or providing an exemption for medical reasons for patients. So I'm not sure of the the distinct or the specific issues that are being brought up, but certainly if there's any, if we can help to answer any of those questions, we'd be happy to. But on that individual basis.
Our next questions are from Jody Cook with NTV. Please go ahead.
Thanks. Dr. Fitzgerald, I guess it would be fair to say we're pretty lucky we're not in a fourth wave right now, all things considered, with the IT systems issue. Should that unfortunate situation arise where we do see another fourth wave hit another community in the province, is there some sort of contingency plan in place for how we will handle this by way of processing and all the other details that go along with it?
Yeah, so if we have an outbreak in another community, certainly we have, public health knows what they have to do to be able to do contact tracing and things like that. And the lab is still able to process samples at the rate that they have been. And so certainly we have the capability to be able to respond to any outbreak if it should happen, which, knock on wood, hopefully it won't.
On the issue of the Vax Pass, we're a couple of weeks into this now. We know that obviously working along with this is enforceable by law by way of compliance. Have there been any fines that have been handed out as of yet?
Not to my knowledge, but I may not actually be aware of that information because enforcement is not in our wheelhouse.
I will now go back through each reporter to see if you have one final question. Garrett Barry with CBC, do you have a final question?
We're in a situation now, Dr. Fitzgerald, where people are going to have to wait longer to get their test results. And if they do have symptoms, they're going to have to self-isolate longer before they get a definitive answer on what the symptoms they have, what's that connected to. Are you concerned at all that that's going to be disincentive for people to present themselves and get a test?
So I think for the most part, people still want to know if they have COVID, and I hope that they'll want to do that to not only know for themselves, but to be able to protect the people around them. And certainly, our advice has always been that people should stay home until 24 hours after their symptoms have resolved, even if they had a negative test. And that certainly still is the recommendation. Certainly our hope is that this testing issue will be resolved today, and that we'll be able to get those people back on track for testing. And we hope that it's going to be a very short-lived thing, and that we'll have this back up online and be able to do what we've normally done before too long.
Richard Duggan with VOCM, do you have a final question?
Yes, I do. Self-serve buffets are still prohibited. With vaccination rates nearing 90% and Vax Pass requirements and all of that, at what point can those return?
So that's a good question. And I guess we'll have to take that back and have a look at that. And, initially it was during when we went to level 1, but, the issue with self-serve is that everybody is handling the same spoon, everybody is handling the same equipment, and then handling food. So there is that risk of being able to transmit COVID in that regard. So perhaps there's ways that we can get around that, but we'll have to take that back. There's no decision been made at the moment.
Peter Jackson with the Telegram, do you have a final question?
Yeah, we seem to be approaching a similar timeline with children's vaccines as we did with adult vaccines last year. Do you think there's any likelihood at all that we will be vaccinated just before or during Christmas, or will you hold off on children's vaccines altogether until the new year?
I know our hope is that we'll be able to do it before then, but I don't know. I mean, it very much depends on when Health Canada approves children's vaccines. So, you know, once that happens, we've been advised that very shortly after that, we'll be able, we will have the vaccine, so we'll be able to start vaccinating.
Jody Cook with NTV, do you have a final question?
Yeah, Dr. Fitzgerald, you and, well, I guess the public in general is armed with the information to see where our vaccination rates are in each region in the province. Are there any areas that you look at where you think could have a vulnerability for a fourth wave like we saw in other areas?
So there are areas that have lower vaccination rates than others, and then there are age groups where there are lower vaccination rates than others. So I don't have, one of the things that we haven't been able to get over the last few days since Saturday is our vaccination rate. So I wouldn't feel right discussing that without having the latest information.
Thank you, everyone. Dr. Fitzgerald, do you have any final comments for today?
Thanks everyone for joining us today. And, you know, I'll say it again, just make sure if you haven't gotten your first COVID shot, please book an appointment to do so. You can also get your flu shot at the same time. If you have gotten your first and it's been at least 4 weeks since your second, since that first COVID shot, you can book to get your second. So you can also go to your pharmacy or to your physician and get your flu shot or your COVID shot. So thanks very much and stay safe.
Thank you, Dr. Fitzgerald. Stay safe, everyone. Take care of yourselves and each other and enjoy the rest of your day.